Welcome to episode 2 of How to Keep Your Teeth Healthy on DrAndrewThorpe.com. Today we're going to be talking about a topic that should be simple, but if you've been to the supermarket lately you'll realise it's anything but, and that's toothpaste. Now if you've been to a supermarket or a pharmacy you'll see that there's a huge range of toothpaste these days, each of them saying they're better than the other brand for some particular reason and does some feature that nothing else does. So hopefully by the end of this video you'll be able to walk into the supermarket, go, that's what I need, and avoid all confusion. There are some minor differences depending on some issues you may have with your teeth and what you want to achieve. So let's look into that a bit. Now first of all, why do we use toothpaste? Toothpaste first of all actually contains a mild abrasive, so it helps to remove surface stains off of our teeth. Now it's not too harsh because otherwise you can cause some damage to the teeth, and if you watch my previous video about toothbrushes, those grooves in the side of the teeth can become a lot quicker if you use something too abrasive. Now the toothpaste also has fragrances in it to try and make your breath feel a lot fresher, and it has also something called SLS or sodium lauryl sulfate, which basically makes it bubble up and give you a good feeling. Some people are actually allergic to SLS, and if you're one of these people who have had cancer or anything before, you'll find that SLS tends to really irritate your gums. So you're going to want to try and find a toothpaste which doesn't have sodium lauryl sulfate on it. Apart from that, fluoride is included in all our toothpastes. Now some don't have it, and they contain other things such as antiseptics or herbal remedies which are designed to kill off bacteria. However, fluoride is the primary reason that we use toothpaste. Fluoride is designed to actually make it harder to get holes in your teeth. So when we're brushing with toothpaste, the reason we have to spend a while brushing, such as taking 2 or 3 minutes to do it, is actually to let the fluoride dissolve into our teeth. So we have to be a little cautious if we do look at using a toothpaste which has no fluoride in it, because we are taking away one of the main reasons we use toothpaste. Now using something without fluoride is still usually better than brushing with nothing at all. But the fluoride is what really gives the toothpaste and brushing your teeth the ability to make it a lot harder to get holes. Now there's more than one type of fluoride available. Most toothpaste will contain what's known as sodium fluoride. It's been used for a very long time, it's been proven reliable and effective, and it's been shown to be safe, provided you don't go eating tubes of it, of course. There are other types of fluoride. Now the other main fluoride available is what's called stannous fluoride. It was popular a while ago, then it seemed to disappear from the marketplace, and it's come back recently with Oral-B Pro Health. Now it's not entirely conclusive whether it definitely is better to have stannous fluoride or whether it has no benefit at all. So if you like the flavour of it, it doesn't seem to be any harm in doing it. However, I wouldn't go seeking it just for that reason, because there are other toothpastes which might be of more use for you. Now, some toothpaste will actually contain an antibacterial to try and kill off the bacteria in our mouth. One example is Colgate Total, which contains triclosan. Now triclosan is a mild antibiotic that helps to minimize how much bacteria is in your mouth. If you've seen the advertising for Colgate Total, you'll see their 12 hours of protection ad, and essentially it's the triclosan that kills a lot of bacteria that's giving them that long-lasting effect. Now you can get a similar effect from chewing gum and staying away from sugars, but triclosan has been shown to have a beneficial effect on your teeth and will in fact do exactly as the marketing says and keep bacteria at bay. Now if you have sensitive teeth, you're going to want to look at one of the sensitive toothpastes. The basic of sensitive toothpaste is it works. Now a word of warning, sensitivity of teeth is generally from some type of cause. Now we'll do a video on sensitivity at a later point, but it's strongly advised you go see a dentist just to make sure that there's not something sinister going on. Because often you can have big holes or grinding, or you can have severe gum disease causing a sensitivity. However, quite often, especially in cases such as gum disease and if you've had a lot of fillings, the sensitivity may linger on even once the cause has been treated. So for these, sensitive toothpaste does work. Now, they all contain slightly different ingredients, and what has been shown is that no particular brand seems to stand out over the other. But if each time you buy toothpaste, you go for a different brand to the time before, it does seem to work better. So Sensodyne, Colgate Pro Relief and a few others, they're all pretty effective. But if you want the best for yourself, each time you go get one, get a different one and it's going to help. Essentially, just use it the same as your normal toothpaste. You just put it on a toothbrush, brush with it for about 2 or 3 minutes, and it helps to reduce the sensitivity that you may be getting. Now, the other main toothpaste that you're going to see is high fluoride toothpaste, such as NutriFluor 5000. These you generally can't get at Coles and Woolies because they're pharmacy medicines, so you're only going to find them at the dentist or at pharmacies. Now, for the majority of people, there doesn't seem to be a lot of benefit in using this over your normal toothpaste. However, for certain people who have a higher risk of getting decay, this is a very effective toothpaste for helping to protect against holes. As I was saying, fluoride is the key part of toothpaste that minimizes how many holes you get. So who would benefit from this? It's mainly if you're a little bit old and you find it a bit harder to brush your teeth these days, this is going to help. Anyone who has gone through cancer therapy will also find this very good because it doesn't contain the agent we're talking about, which basically foams up and irritates your gums. And if you've had any type of cancer therapy, you'll find that it's a lot easier to get holes in your teeth. So this is going to help a lot. Also, anyone that seems to get more than just the occasional filling is probably going to benefit from this as well. Now, children can't use this, so it's generally suggested no one under about 15 years old or so uses this toothpaste. And you want to keep it out of reach of children as well. Fluoride is fairly safe provided you don't eat lots of it. The trouble is most toothpaste is flavoured to give you that fresh breath and taste good. So if a child gets a hold of it, they're going to eat the whole tube. And a whole tube like this does have the potential to actually kill them. So make sure you keep it out of reach and don't let children use it. They don't have any benefit from it and the risk outweighs the benefits from doing so. So at the end of the day, what's the best toothpaste for you? If you don't have sensitivity, you don't have a huge risk of decay, most toothpaste is going to work. There are some benefits from using something like Colgate Total with an antibiotic in it. There may also be benefits from using something as the Oral-B Pro Health with stannous fluoride. But basically pretty much any toothpaste that has fluoride is going to work. So just pick whatever tastes the best and whatever you're happy using. If you've got sensitivity to SLS, such as you get a lot of ulcers or you've had cancer therapy, you want to look at some of the ones which don't have sodium lauryl sulfate in it. The easiest way to find that is either ask a pharmacist, ask a dentist, or they're usually on the bottom shelf down at Coles and Woolies because not too many people want to buy them. You can tell if it has SLS by if it foams up in your mouth or not. If you get a lot of holes, or if you're undergoing any chemotherapy or cancer treatment, the NutriFluor is going to be where you want to go. And if you do get a lot of sensitivity, you're probably going to want to look at using the sensitive toothpaste. They do work, just remember to change brands as often as you can. Now we haven't gone into whitening toothpaste just yet. The main issue of whitening toothpaste is that it's only effective for a very small proportion of people. Most people who have tried it do complain that they get a lot of tooth sensitivity from it, and it's just regarding the chemicals that are used to whiten your teeth. Unfortunately, it seems to be that the concentration in it isn't too effective at whitening, but strong enough to still give the tooth sensitivity that people who do whitening seem to get. So if you have very heavy smoking stains or very heavy teeth stains, it's going to do some benefit for you. But majority of the time, it's probably going to lead to more sensitivity than actually benefiting you. So just use those with a bit of caution. Now there are other pastes which help to prevent against holes. So in the next video, we're going to look at something very useful that goes with toothpaste that not only can prevent holes, but may actually help to reverse very small ones. Until then, I hope this has been of benefit for you. Take care.